Thank you for coming to be immunised against COVID-19 today. You are receiving the Astra Zeneca vaccine. My name is Dr. Michelle Redford. I'm a GP, and I'm going to take you through what to expect after your vaccination. The Astra Zeneca vaccine is a safe and effective vaccine. It is suitable for people aged 18 and older, including during breastfeeding. Having 2 doses of the Astra Zeneca vaccine gives you excellent protection against serious illness from COVID-19, and you will develop that protection in about 12 to 14 days from today. If this is your first dose, you'll need to have a second dose after 4 to 12 weeks to make sure that your protection lasts longer. No vaccination can completely prevent COVID-19 infection, so it's still important that we all continue to take precautions and follow the public health advice after we've been vaccinated. If you are unlucky enough to catch COVID-19 in the next 2 weeks before you're fully protected, your second dose will need to be postponed. That would usually be until at least 3 months after you've fully recovered from the infection. Serious side effects from the vaccine are rare, and the benefits of having protection against COVID-19 far outweigh any risk from vaccination. As a safety measure though, please remain in the observation area until at least 15 minutes have passed. This is so that the team can look after you if you have any side effects. Anaphylaxis is extremely rare after this vaccination, affecting about 1 in a million people. Most side effects from this vaccine are mild and are more common after the first dose. They tend to start a few hours after vaccination and settle on their own within a couple of days. About a third of people don't have any side effects at all, but the vaccine will still be working whether you have side effects or not. The sorts of things that often happen are a pain or swelling or redness or itch at the injection site in your arm, tiredness, headaches, aching muscles or joints, feeling sick or unwell, fever, and chills. Less common side effects are enlarged glands, which are lymph nodes, which might be in your armpit or in your neck, dizziness, poor appetite, and stomach pain. If you feel unwell with these sorts of symptoms, you can rest, take paracetamol or ibuprofen if you need to, and look after yourself at home. If you're not sure about what to do, you can use the COVID-19 vaccine side effect checker on the Health Direct website for advice. This vaccine cannot cause COVID-19. But if COVID-19 is in your community, you should always be watching out for symptoms of COVID-19. So if you have a fever that starts more than 2 days from now or continues for more than 2 days, or you start to have things like a cough, sore throat, runny nose, or loss of sense of smell or taste, then please get tested for COVID-19 and seek medical advice via the phone or telehealth. Now, rarely, the AstraZeneca vaccine can cause a serious condition called thrombosis with thrombocytopenia syndrome, or TTS. This is different from the side effects I've already described because it doesn't tend to start till about 4 days after vaccination, but it can happen up to 6 weeks after, whereas the usual side effects happen in the first day or 2, and they go away on their own. It's important to know about TTS and what to look out for because it is a serious condition, but it can be treated if it's caught early. TTS causes unusual blood clots in different parts of the body, like the brain or the abdomen, the lungs, arms or legs, as well as a low blood platelet count, which can cause bleeding. TTS is caused by a sort of immune system overreaction, and so it's different to other types of blood clots that people might be familiar with. It happens in between 2 and 5 per 100,000 people after AstraZeneca vaccine, and it's less common in men and people over the age of 60. The risk of dying from TTS after AstraZeneca vaccine in Australia is about 1 in a million. I'm going to take you through some of the symptoms of TTS. If you experience any of these, you should seek immediate medical attention. So the first one would be a headache that continues beyond 2 days after vaccination or starts more than 2 days after vaccination and doesn't go away. So some people have described this as being like a hangover, and paracetamol might help it, but then it comes back. Sometimes it's worse when people are lying down or people also feel sick with it. Another thing to watch out for would be what we would call neurological symptoms, so symptoms from the nervous system like blurred vision, difficulty with your speech, drowsiness or seizures. I think if you had these symptoms, generally you would seek medical advice regardless of whether you were vaccinated or not, but it's important to know that you must seek medical attention if you have these following AstraZeneca vaccine. Other things to watch out for are shortness of breath or chest pain, swelling, redness or pain in your leg, belly pain that doesn't go away, and tiny blood spots under the skin that are not near the injection site. GPs and emergency departments have protocols to follow if they suspect this condition, and early treatment improves the chance of a good recovery. In Australia, we're keeping a really close eye on side effects from COVID-19 vaccines, and GPs and other vaccine providers are part of the reporting system. If you want to, you can also report side effects directly yourself via the TGA website. Thank you again for choosing to be vaccinated against COVID-19.